Hello everyone, I'm Dennis McCarthy, your host for Inside Olean General Hospital, a news and information program about our community's hospital and the progress that we're making on behalf of our patients. With me today is Tim Finan, who's the President and CEO of Olean General Hospital and the Upper Allegheny Health System. Tim, thanks for joining us today.
Sure, Dennis.
This is a very, very exciting time in healthcare. There's a lot of emphasis these days on patient safety, improvements in technology. What I'd like to do is talk a little bit with Tim today because there's a lot going on at Olean General Hospital with regard to safety improvements and technology improvements, new services too. So Tim, could you talk to us a little bit about some of the new improvements and the things that quality is all about in hospitals?
Well, from a patient safety standpoint, I think three programs come to mind that we're particularly proud of. One is the introduction of smart IV or intravenous pumps. Secondly, the intensivist program that we've had for about 18 months, and then the chest pain center. So perhaps you'd like me to run through each of those.
Yeah, what is a smart pump and what does it do?
It's a computerized drug infusion pump that has factored into the memory of the pumps over 400 drug dosing rates, so that you can be assured that the drugs that are infused are not running too slow or not running too fast, and accordingly you're able to bypass any significant patient risk.
So basically it's a computerized pump of some sort and measures everything automatically and delivers it.
Yeah, absolutely. We're infusing narcotics, thrombolytics, anticoagulants, sedatives, and if they're not running at the right rate, they can pose significant harm to patients. So this, as I said, gets beyond all of that. There are over 175 computerized or smart pumps that have been introduced at Olean, and it really provides a measure of safety that really is cutting edge.
And certainly that's not a cheap investment on part of the hospital. That's the costly investment in a lot.
Yeah, I think Dennis, this investment was $500,000 at Olean.
It's significant.
Significant.
What is an intensivist? You mentioned we have intensivists at Olean General Hospital for the consumers. What does that mean? Who are they?
Intensivists are physicians with special training in critical care, and they're critical care specialists. And they basically, at Olean General, are physically present in our ICU. That's where they're stationed, 12 hours a day from 7 a.m. to 7 p.m. And then we have an apartment for them in the hospital, so they're always in the hospital 24/7. And they manage the care of our ICU patients, and as everybody understands, the ICU is where our sickest patients are. What I think is interesting about this is there are only 15 to 20% of the hospitals in the country that have ICUs run by intensivists. And the clinical literature cites a 40% reduction in ICU mortality in ICUs run by intensivists. And so, we think that is very, very significant. Again, our sickest patients are in the ICU. We have a captain of the ship. We have a single standard of care. And it's been a phenomenal improvement in quality and safety across the board.
It sounds like it's another significant piece of work that the hospital has done to protect patient safety and improve quality. You mentioned the chest pain center. Now, this is a pretty important program because there's a lot of other programs that are kind of tied with it in terms of the cardiology capability that the hospital has and is getting. So could talk a little bit about the chest pain center.
Well, the chest pain center and chest pain centers generally assure two things. Number one, that the standard of care provided to patients who present in the emergency with chest pain is evidence-based, meaning that the care is, according to the research, is care that has the best outcomes. And the second thing that the chest pain center or chest pain centers accomplish is a very expedited pace of ancillary testing. So, for instance, at Olean General now, by virtue of the chest pain center, we are receiving and interpreting all our EKGs for chest pain patients within 10 minutes. In fact, we've worked with all the advanced life support ambulance companies, in the region to make sure that they have 12-lead EKGs in their rigs, And they've helped us, we've worked with them to transmit these EKGs from the field to Olean General. So it is not at all uncommon for patients with chest pain when they're wheeled into the ER that their EKG is already here and interpreted. The second piece of testing that is expedited is troponin testing. And troponins are a lab test that indicate a heart attack, that a heart attack's occurred. And historically and typically, when they were sent upstairs to our lab, it was a 90-minute turnaround. But through the introduction of point-of-care troponin testing, we're now able to get those results back in 25 to 28 minutes. So, you know, with cardiac issues, chest pain, specifically, time is muscle. So the quicker we can get an EKG and the troponins, the quicker we have that test turnaround time, the quicker we're able to diagnose serious issues and then deal with them accordingly. So this has significantly raised the bar in terms of the treatment of chest pain in the region. We've been at this for 3 years under the direction of Dr. Ahmed Halal, a cardiologist who is the Chest Pain Center's medical director. In fact, in April, we will be applying for Chest Pain Center accreditation, and I believe there are only 10 to 11 hospitals in New York State with Chest Pain Center accreditation. So this is a very, very big advancement for the region and our patients.
Now, Tim, the health reform, the national health reform, Obamacare, whatever everybody's talking about, it is a extremely confusing world for the consumers. We now have something out there called sequestration, which adds to the fun. But what is the impact on health reform to hospitals and really the consumer too? What are they going to see? How's it impacting the hospital and how does it impact the consumer?
Well, you know, I generally think, and I think most people in the business would say as much, I mean, politics aside, that health reform is a good thing. First of all, we have too many uninsured people in the United States, 45, 50 million. One of the manifestations of that is the bad debt that every hospital confronts. This hospital, for instance, has bad debt of over $5 million a year. These are people who maybe don't qualify for Medicaid, but who can't afford health care. And so they need to come to the hospital for a problem they're unable to pay. That creates a huge issue for hospitals and providers of care, you know, everywhere. So, you know, one of the, you know, tenets of health reform is to, you know, significantly impact the number of uninsured in this country, which I think is basic to controlling costs. But it does much more than that. It begins to shift away from kind of paying just for care received and instead reimbursing on the basis of value. You know, the notion being that, you know, if a hospital does a really fine job taking care of a heart attack, for instance, they should be reimbursed more than a hospital that maybe does an inferior job. So I think, you know, that is laudable. The other thing, it begins to hold insurance companies and HMOs specifically more accountable in terms of their care by putting a floor on the amount of the healthcare dollar that they spend on care. For instance, HMOs or insurance companies need to spend 80 or 85% minimally on care. We have a lot of for-profit health insurers in this country who are only spending 60% of the premium dollar on health care right now. And the balance is accruing to the benefit of shareholders and you know, healthcare executives. So I think there are some things in health reform that are very, very positive. You know, the issue of how it gets paid for and you know, whether you're for a single payer system or whatever, I'll leave that to others. But I think that first and foremost, everybody in this country deserves to be insured. I think it's a basic right. Because we have an employer-based health insurance system in this country, a lot of employers are unable to do it because increasingly it's difficult in the global economy to afford, you know, this extra expense, and you know, on and on it goes. The issue of sequestration, Dennis, which is a new word for all of us.
It came into being within the last couple of months.
Right. It's been occasioned by the federal deficits. So because our politicians and legislators in Washington have been unable to or unwilling to compromise or reach agreement, there are automatic cuts that took effect on March 1. And for this hospital and hospitals throughout the country, we're going to have a 2% reduction in Medicare payments beginning April 1, if nothing changes between now and then. And that's going to cost this hospital $925,000 a year annualized. And that's going to be very, very difficult. In our Bradford hospital, it's about $625,000 a year. So out of our 2 hospitals within Upper Allegheny, it's over $1.5 million of reductions just off the top.
And that's 2 hospitals out of thousands, which
2 hospitals out of thousands, yeah, and everybody is going through it.
Now, patient care is, look into the future a little bit, if you could. Things are beginning to change a little bit. We're looking more and more at outpatient services. You mentioned places like Delavan and services that are beyond the hospital's walls, and better management of things like chronic disease, that we need to do a better job. What's going to change over the next few years? What do you think people will see in the way healthcare is delivered?
Well, I think, electronic records are going to be in vogue. I mean, absolutely, positively. Patients will be able to connect electronically with their physicians, be able to review their records, send notes to their physicians, electronically communicate via complaints, make appointments, all online. This is not cutting-edge stuff with the airlines, for instance, in terms of being able to make appointments, but certainly for patients, this whole notion of patient portals and electronic connectivity with caregivers, I think it's a very positive thing. And the fact that our physicians throughout the community and with physicians up in Buffalo and beyond, the electronic connectivity is going to facilitate care, interject a measure of safety that we haven't enjoyed up to this point. It's not going to be hard copy, kind of illegible, handwritten records anymore. And I think that, so we're going to see a lot with electronic records. The other thing that you mentioned is the management of chronic disease. The health system has to do a better job managing chronic disease on the outpatient side of the house. And by that I mean diabetes, congestive heart failure, things like that. And this is not just in our region, but every region, because these are the individuals who really end up in the hospital time and time again. It's not fair to them. It places a burden, too, on the health system. And so there's going to be a big emphasis on doing a better job of managing chronic disease in an outpatient setting so that these patients can be kept out of the hospital, which obviously, hospitals are a lot more expensive than outpatient care. And our patients' quality of life will improve as well, and that's most important.
The hospital really is going after the cardiology and cardiac issue very full force. And you mentioned earlier as well, we're going to have a new capability there at the hospital soon. Could you explain that?
Well, yes, and I think that cardiac disease is a huge issue in the region. It's a huge issue nationally, so it makes sense for hospitals to pursue this. But in addition to Chest Pain Center, the Chest Pain Center, we have been approved by the New York State Department of Health to initiate an interventional cardiac catheterization program at Olean General. And the interesting thing about this program is that it's being done in conjunction with Kaleida Health, upstate New York's largest provider of cardiac services. So this program will be jointly sponsored here in Olean, jointly operated, sponsored and operated by Olean General and Kaleida Health. So we will be able to, for appropriate patients, do an angioplasty if it's indicated and needed, place a stent if it's indicated or needed, and again, be able to do this in partnership with Kaleida Health. In fact, Kaleida has taken a catheterization lab offline at High Street at Buffalo General, and they've we've reestablished it here in Olean. So this is, in terms of a patient presenting with chest pain, if there's an indication for an intervention, they'll be able to go right across the hall.
So this is really the only program of its kind in the area down here.
It's the only interventional cath program, and again, I think the people in the area can take real comfort in the fact that we're doing this, again, in partnership with Kaleida Health out of Buffalo.
Certainly cut travel time for patients to go for procedures, too.
Well, absolutely, and we're working with Kaleida to recruit interventional cardiologists. In fact, they will be employed by Kaleida and stationed here in Olean 24/7, 365. and Dr. Gary Maurer is coming on board in June. So that's very significant. The other thing I could add, Dennis, is that 8 of our nurses spent 16 weeks at Kaleida training in the cardiac catheterization lab, as did 2 of our radiology technologists. So they're ready to go.
It's quite an effort. It sounds very exciting for the region, and really an issue where it's going to be right here near home, and people don't have to travel to Buffalo, Rochester, Erie, or Pittsburgh to get those services.
Yeah, well, I think that you know, in the year 2013, I think it's, and with technology and where it is, you know, people who live in small communities shouldn't be penalized, you know, in terms of having to travel on a snowy road in the middle of winter to Buffalo for interventions or procedures that can be safely done in community hospitals. And so we're excited about that, and it's somewhat, the relationship with Kaleida is somewhat analogous to the relation in radiation medicine that we have with Roswell Park. This notion of bringing experts in from out of the region to support our work here and doing that in partnership. And so, you know, it's really beneficial to be able to partner with, you know, Kaleida in interventional cardiology or Roswell Park Cancer Institute in radiation oncology.
Well, that's a lot new, but that's not all that's new, because I know the hospital has been expanding out, looking at new health centers, new surgical outpatient facility, and even some new physicians. Can you talk a little bit about the capabilities that we're doing there? I know it's beyond the walls of the hospital now.
Well, sure, Dennis. We opened a new primary care center in Delavan, New York. It's a primary care center and also has a dental center attached to it. We have 6 dental chairs and then I think 4 or 5 exam rooms in primary care. What I think is significant about this program, and it opened a few months ago, is that Delavan, New York is, first and foremost, it's part of the Olean General Hospital service area, primary care service area. It's 31 miles up the road, up Route 16. Delavan is a designated medically underserved area. It's also a federally designated dental professional shortage area. So by introducing a primary care program in Delavan with a dental program, we're responding to 2 deficits, you know, in the Delavan area. And yeah, the primary care center has been very, very busy. The dental center has been very, very busy. So, you know, we're responding to a significant need, and the center is beautiful, and you know, we're really happy to be in the Delavan community.
It sounds like a really great center for the community up there, and I guess it seems to be the way hospital work is going, reaching out and making sure access is available to people out in the rural areas.
Well, you know, again, it's the Olean General Hospital service area is quite large. I mean, from a geographic area, and to expect everyone to get in a car and travel, you know, especially in the dead of winter, 30, 40 miles is a little naive. And I think that, you know, we owe it to everyone in the service area to improve access.
That sounds great. And lastly, I think you talked earlier about not only have new services, new equipment, new doctors too.
Yeah, we have a few new physicians in the area. We have a wonderful physician recruitment team here, but there's a new urologist in town, or he's just returned. He's born and raised in Olean, Dr. Gary Carl. So his office is at 623 Main Street. We have a new oral surgeon over at our Gunla Dental Center, Dr. Peter Bliss, who was born and raised in Jamestown. So you can see the theme here, people coming back home. And I mentioned Dr. Gary Maurer, the interventional cardiologist, who's not from Olean, but we're happy to have him anyway. The other programs, Dennis, that you mentioned, you know, our new Mildred Milliman Outpatient Surgical Center opened in May. You know, it's just done very, very well. It's just, you know, geared to the outpatient, you know, the outpatient procedures, and it's a very expedited flow versus
Beautiful
what was
facility.
Present, yeah, in the hospital. It is. It absolutely is.
It is. Well, thanks again for being with us, Tim. This is our news and information program on Olean General Hospital. If you'd like more information on Olean General, please visit our website at www.ogh.org. I'm Dennis McCarthy. Thanks for being with us.